Cancer survivors could soon see a better quality of life. A new clinical trial led by the National Cancer Center is being done, and it's examining how traditional Chinese medicine, otherwise known as TCM, can be used to counter cancer-related fatigue, one of the side effects frequently experienced by patients after cancer treatment. This modified TCM formula will be tested for its effectiveness in alleviating cancer-related fatigue. It comes in the form of granules and can be dissolved in water and consumed orally. The formula is made from 15 herbs, including the seed, root, bark, and fruit of various plants. 80 cancer survivors are expected to be enrolled in that trial over 2 years, with each given either the TCM treatment or a placebo for 8 weeks. Thereafter, they'll be assessed on factors like their fatigue levels and cognitive function. For more, we're joined by Dr. Tira Tan. She's Principal Investigator and Consultant with the Division of Medical Oncology at the National Cancer Center. Good evening, Dr. Tan. Tell us why specifically the focus on the use of TCM to counter cancer-related fatigue?
Yeah, thank you. Hi, Don. So, we're getting better at cancer therapy. And as we see successes in cancer treatment, we're also seeing a higher number of patients with cancer-related symptoms and cancer treatment-related side effects. And one of the side effects, as you mentioned, is cancer-related fatigue. Now, currently, when we see a patient with cancer-related fatigue, frankly speaking, the treatments that are available are fairly limited in terms of its scope and efficacy. So some of the treatments may include non-pharmacological measures like exercise or cognitive behavioral therapy. Some pharmacological managements may include antidepressants or stimulants, but these drugs are not as efficacious as we would like it to be. So we've identified that there is this gap that remains and sought to find an intervention that is culturally appropriate. We've noticed that our patients that we see in Singapore often turn to alternative medications or adjunctive therapies, such as traditional Chinese medicines, to manage persisting symptoms, and hence the design of this trial.
And Dr. Tan, can you give us some examples then of how cancer-related fatigue impacts a patient's quality of life?
Right. So this is a persistent subjective sense of tiredness. And patients who have cancer-related fatigue often report that it prevents them from doing activities that they would usually pursue. For example, going to work, exercising, socializing. And in its severe form, some patients also report that it actually interferes with them performing activities of daily living, such as cleaning themselves, cooking, doing the shopping, for example.
Dr. Tan, cancer treatments are typically Western medicine. Are there any risks of incorporating traditional Chinese medicine post their treatment?
That's a great question, and that was something certainly that we did think about as we were designing this study. So we specifically selected patients who have completed their active cancer therapy so that we don't run the risk of Chinese medications interfering with their cancer therapeutics. Additionally, when patients are enrolled onto the study, they're actually reviewed periodically by Chinese physician as well as our study team. We're monitoring them really closely for any side effects. We're looking at their symptoms. We're also doing laboratory assessment to assess their organ function. And in that way, this trial is being conducted safely.
And with that in mind, are there specific patient profiles then that will not be suitable for this trial, and why?
Yeah. So we're looking at patients who are being seen at National Cancer Center who are in remission from their cancer and have completed their active cancer therapies such as chemotherapy, radiation, or surgery for at least a month. These patients must have a moderate level of fatigue that we can score. We do exclude patients who have a prior history of brain cancers because, unfortunately, some of the brain cancer therapies are associated with cognitive impairment, and this can affect the results of the study. We're also excluding patients who are currently on Chinese medications or who have other medical conditions, which may also cause fatigue.
Okay, May, thanks for your time this evening. We've been speaking with Dr. Tira Tan, Principal Investigator and Consultant with the Division of Medical Oncology at National Cancer Center.